Hi, we're Getting Wiser with Dr. Wiser, and today on our podcast, my guest is Dana Torregiano, who's the owner of Moving Forward Wellness here in New York. She specializes in post-surgical rehabilitation and lymphedema therapy. Dana, thank you for being with us today.
Thank you for having me.
I want you to give someone who hears us today and he's about to go for surgery, give him some tips regarding to how can he prepare better in terms of lymphatic therapy.
Before surgery, it would be very important to, depending on the area that you're having the procedure done, make sure that you feel as though you have a good amount of pain-free range of motion in this area, that you can twist comfortably, and that you have good range of motion in the soft tissue. Also, the first thing that I would tell somebody to practice that they can do preoperatively and then continue on postoperatively is deep abdominal breathing. It doesn't require any hands-on skills. It's relaxing, arguably good for all of our stress levels, and it's very effective in increasing lymphatic return. The largest vessel in the lymphatics is the thoracic duct, and it runs upward through the cavity next to the abdominal aorta and returns lymphatic fluid back to the left venous angle. But in doing so, it has to work anti-gravity, which is very difficult, and it's not the easiest way to move fluid. Additionally, the lymphatics are not directly connected to the cardio system, so it does not have the heart pumping. So it relies purely on movement, gravity, and pressure changes. And deep abdominal breathing allows the fluid to literally get pumped upward, anti-gravity, by creating pressure changes in the abdominal cavity with the diaphragm contracting and relaxing. So doing deep abdominal breathing helps all the deep lymphatic system get moving. And then once you do that, if you have good range of motion and movement, just moving your body can then help your body return some of this fluid, this postoperative fluid, to the lymphatics. So the first thing I would have somebody do is make sure that they feel like they have good range of motion and understand how to fully range the body parts that they're going to have surgery on, and that they feel comfortable doing deep abdominal breathing.
Okay, 3 things. What would be your recommendation? And of course, if they can, see a lymphatic therapist.
Of course.
Before.
Of course.
What would be your tips for people after surgery in terms of lymphatic therapy?
After surgery, I would say if you have an idea of some trained lymphatic specialists in the area, you can go to their websites, see if they have any helpful resources for patients. And then I would make an appointment with somebody, even just for one consultation, one initial assessment, just to get an idea of if the things that you're doing at home, if you're doing them correctly, how often you should be doing them, if there's more optimal times of day for you to be doing them, and what compression garments may or may not be good for you. A lot of people want to just buy things that they see online, or they saw someone on TikTok or Instagram wearing, and it's either not appropriate for them or perhaps it's not the right level of compression.
You mentioned compression garment, which is a whole new world of complexity. What is your take on compression garment, and what are the rules that you follow when you recommend a specific compression garment to a patient?
So it's very interesting because there are some general rules that as a lymphedema therapist you learn when you're getting trained. And that is, you want to have the most compression that a patient can tolerate, and you want them to wear it during the day. You want them to move in it, but you don't want them to sleep in it. However, in practice, what is appropriate for somebody after a cosmetic procedure often, or even a reconstructive procedure, is that they are in compression, that they're in very, very tight-fitting compression, and that they do wear it to bed and they wear it all day. What I find the trick to be, though, is that wearing it without a break, while it is helpful for skin stretch to help the skin retract, and for you to not get stagnant swelling over an operative area, you need to take it off more often than anyone would like to. These things are very tight. They take a lot of finessing to get into, especially, what people are calling like faja garments for the trunk. So people want to put them on and leave them on, and I understand. But what I tell them, which is very inconvenient, is that you should be taking it off a few times a day and letting your skin move without this compression on it. Because while it's flushing out the lymphatic fluid and the postoperative fluid, which we want, it's also flushing out blood and oxygenated blood that we need to actually get into some of those areas. And while we want there to not be any swelling, we also need there to be some skin stretch, because the body is not going to effectively move that swelling on its own if it gets tight and it doesn't have any skin stretch on its own. So I try to encourage people to, I know your surgeon told you to leave it on all day, all night, and please feel free to call them and tell them what I told you, or I'll call them for you and we can have a dialogue about it. But my recommendation is that you take this off and that you gently, even before doing manual lymphatic drainage, just start touching your skin. And I tell people to do what I call a wave into these areas. Often, like for instance, a tummy tuck. Somebody takes off their compression garment and their skin looks shiny. Their skin looks tight. Their waist looks great. But you touch it and it feels hard. Right. The skin feels really firm. Often these patients are completely numb, so they're really not sure how it feels, but they know that it feel like they're wearing a little bit of a corset even when they take the faja off. And I tell them, just start doing a wave into your belly, lying down, pairing it with the breathing that I've presumably already given them, and just do it. And everybody wants to know, how long do I have to do it? How many minutes? How many repetitions? And I don't like repetitions and I don't like minutes when it comes to these things, because what I tell people to do is do it until it feels different. Do it until it feels like you actually made a difference. And I tell them to do this over their breasts, if applicable, and over their abdomens, over their arms, if applicable, depending on where the surgery was, their face. Don't worry about moving the fluid. Your body's going to do some of that. The compression garment is going to force your body to do some of that. Worry about softening the skin.
Okay.
And this is the guidance that I give to people. So even going back to your previous question, you said, what tips can you give people? I should have included there right at the top is the deep abdominal breathing and moving, but also removing compression garments, touching your skin, which is also good for the sensation, but softening that skin.
I found it kind of tricky when I try to fit the garment for the patient pre-surgery, because you need to be a little bit of a magician to understand how much you're going to take off. And even after, you usually give them at least 2 garments, because they lose a lot of swelling, and then you want to still maintain the same compression. How do you address that?
So I actually am always fascinated by a plastic surgeon's ability to really guesstimate these things, because being honest, I, absent of just telling somebody like, see what size you are now and go a size down, there's really not an exact science to it. So plastic surgeons are great at that, because plastics already can tell somebody, I'm going to put more into this breast than that breast, because once it settles, your body's going to reabsorb this much. I mean, I always find this very fascinating. But when it comes to compression garments, my guidance is always to get something. Some of these patients may already own things like Spanx.
Yeah.
And so absent of like a very long shipping time for some of these compression garments, I really prefer that some of them wait until afterwards to order it. And maybe have something that's less expensive and just more stretch.
Okay.
Initially postoperatively, because then they have something and then they can go from there and actually measure for a size. And a lot of these garments, what I do find very helpful is that garments that are true compression garments, their websites and those description boxes under the garments often are very helpful in helping people figure out what size is right for them. Because they will tell you, if you're measuring preoperatively, for this procedure, we recommend that for this measurement, you go 1 size down, or that we already have the measurements for postoperative measurements. And so I like to go brand by brand And often I do defer to a surgeon unless they ask me what I recommend. I defer to the brand they like. This is their patient. They just put in a lot of work, and ultimately if something goes wrong, the patient's going to go back to them. So I'll defer to them on what brand they prefer. But I really am a big believer in reading a brand's description of a product and calling their customer service if anything's vague and picking their brain about what they see.
Did you find that some of those more inexpensive, the cheaper brands, that there's something in the fabric that might cause some skin abrasions or be a little bit too aggressive with the skin, especially during early recovery time?
Yeah, the some of the issues with them is that often they do not have any hooks or zippers.
Right.
They have pull-on methods, and depending on the procedure, if somebody just had a tummy tuck, you may not want them pulling something up roughly over this incision. I have in recent days been telling people to get things like Glide, which is really meant for runners to avoid chafing, and putting this on some of the areas that they will have to slide a garment up on, or anywhere that they feel like it might be pressing into, and it just helps the garment glide over the skin more easily without causing any kind of
That's a great tip.
an irritation. Yeah.
Okay.
Glide for runners.